Katie or Ron? Did I totally get that name wrong?
You were close.
Right.
Oh, Rona.
Rona.
It's Corona without the C.
Okay.
That's what I tell people. Hi,
It looked like
everyone.
a G. I'm sorry.
Sorry.
Yeah.
I'm Katie Rona. I'm the health policy analyst at Rhode Island Kids Count. I know some of you, but not all of you. I just started in June, so it's nice to see everyone. I have 3 main points. The first is that as a child advocate, it would be remiss of me not to advocate for the group to think about how payments and how reimbursement rates affect the most vulnerable of our population, specifically kids and their families, and especially those who are receiving Medicaid in the state. Second, I know that the group is charged with looking at reimbursement rates. However, many of the adverse health outcomes we are talking about, yes, they have to do with payment, but healthcare only accounts for 20% of your overall health. The other 20% is genetics, and then 60% are more macro structural forces like social determinants of health and individual behavior, which is determined by social determinants of health. Just had to put that plug in as a public health person. Additionally, individuals of color in this state continue to disproportionately have worse health outcomes due to avoidable differences in social determinants of health, access to resources, and structural forces that are at play. Just wanted to remind the group of that. And then lastly, I just ask that you consider us as Rhode Island Kids Count as a source of data and advocacy expertise as you move forward in this process. And thank you for the opportunity to speak. I appreciate it.
So just one comment on that I'll have is that I have a long list of comments that I may or may not, I shortened my comments, introductory comments, and I presented some of what we could responsibly discuss, and one of them was that I left out was what do we want to also talk about access to prenatal care going up the aging scale, and what reimbursement and network adequacy and what that has for different challenges as you go through childhood, adolescent, geriatric, and that's a whole nother realm of what we could discuss as impacts. And so I know we will enter that realm, and it's very important.
Thank you. I appreciate it.
Anybody else, public comment that didn't sign up? If there's no more public comment, with all I've left you as far as getting back to the commission about what you want to go ahead with as or be interested in going forward, if you get back to Molly on all that, I think we can adjourn and look forward to a meeting probably before we get too close to Christmas as our next meeting, and probably January and February for the 2 meetings after that. And we'll get back to you with more specific dates, but probably this time of day, and something that doesn't that stays in the teens of December rather than going into the 20s of December. If there are no further comments, motion to adjourn. Thank you very much.
Thank you.
Yeah.